So based on Mr. Lopez's presentation, dehydration and or electrolyte imbalance are high on the differential diagnosis list. It's also important to note that older adults, such as Mr. Lopez, don't always present in a typical manner with their symptoms for these things. And older adults might have instead acute confusion rather than the classic signs of illness. Mr. Lopez demonstrates several findings that are consistent with dehydration and or electrolyte imbalance. Comparing his visit from 3 days earlier, he has experienced an acute decline in both cognition and function. He's now confused, lethargic, dizzy, and he requires significantly more assistance than he did before. His resting blood pressure has dropped, as well as he is now presenting as tachycardic with an increase in heart rate, as well as an increase in respiratory rate. And these changes could indicate dehydration or electrolyte imbalance affecting his normal bodily functions. Mr. Lopez is at an increased risk for dehydration because he's an older adult and he already has heart failure and diabetes, and he's also taking a Lasix, which is a diuretic that increases urinary removal of sodium in water, but with it can cause electrolytes to also be lost in the urine. So this just increases his risk of being dehydrated. I would ask Mr. Lopez and his wife a few questions, including fluid intake and how often he's drinking, when was the last time he drank, how much has he been drinking, also eating wise. Same thing, I would ask about any recent vomiting and diarrhea. I would ask about urinary frequency, like how frequent, and also maybe what the color of that urine would look like. And then I'd also ask whether she's recently noticed any weight loss, because there could be significant weight loss from a decrease in fluids in the body. I'd also ask about any recent medication changes, especially including his diuretics and any other medications, if there's been additional medications, and the timing of those medications, and if he's taking them as prescribed. I'd also reassess vitals, all the vitals we mentioned before, and also temperature. I would also look at orthostatic blood pressure. I'd also observe for dry mucous membranes, decreased skin tugger, though this can sometimes be less reliable in older adults, it still gives a good idea. And then general weakness and fatigue. And because of that acute cognitive change that he's recently had, I'd also screen for delirium using the CAM, as delirium is often seen with individuals who are older adults who have dehydration. And then I would recommend that he get a panel done. So I would send him to the ER because of the acuteness of the situation, and I would recommend that they do lab testing to include sodium, potassium, chloride, bicarbonate, BUN, creatine, and glucose. I'd also recommend evaluating the BUN to creatine ratio because that can help identify dehydration. And then potassium, I feel like, is especially important because he's taking the Lasix, and he could have a decrease in potassium in his body from those Lasix, and that could potentially cause hypokalemia, which can lead to muscle weakness, fatigue, cramping, and cardiac arrhythmias. And it's especially concerning because he's stated to have an irregular rhythm currently. Regardless of whether dehydration is the cause, Mr. Lopez is medically unstable. His acute delirium, hypotension, tachycardia with his irregular rhythm, his dizziness, and rapid functional decline are all red flags that would indicate sending him to the emergency room.